Hey, good morning. I'm Dr. Steve Stites, the Chief Medical Officer at the University of Kansas Health System and Executive Vice Chancellor of the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. Today, we're learning about emphysema, a chronic lung condition affecting millions of people worldwide. It's usually caused by exposure to irritants like tobacco smoke or any other kind of smoking that you shouldn't be doing. But in rare cases, emphysema can be genetic and can make it hard to breathe, even in people who have never smoked. Today we're meeting someone who lives with a genetic form of emphysema known as alpha-1 antitrypsin deficiency, or AATD, or just alpha-1. We'll find out how she learned she had alpha-1 antitrypsin deficiency, what she's doing for treatment, and what it means for her children. Joining me today is Dr. Leonard Riley, a pulmonologist working both here at the University of Kansas Health System and the Kansas City VA Medical Center. He is a specialist in alpha-1. Great to have you here.
Thank you very much.
Can I say alpha-1 instead of AATD? Because that is no faster than saying alpha-1 antitrypsin. I just say alpha-1.
Strongly encourage you.
Okay, there you go. We're also happy to have Becci Ryberg here. Becci was diagnosed with alpha-1 in 2022. And she found herself teaching her own doctor about this disease until she found Dr. Riley. Thanks so much for being here.
Thank you.
All right. Becci, can you tell us a little bit about your history of breathing problems and how you finally decided to see a pulmonologist, or what we would call a lung doctor?
Sure. So
a brainiac, or a brilliant person.
I am one of the smokers that you spoke of.
No.
I know. I finally.
bet not anymore, though.
No, not anymore.
Oh, okay.
Certainly
That's
not.
good.
The last time I quit smoking was in August of 22, and every other time I'd quit before that, I'd bounced right back, and my lung function came right back to me. It almost seemed to get worse this time. So I went looking for a pulmonologist and made an appointment with a guy out of Advent. And Dr. Roberts is very educated in being a pulmonologist, but I did find myself asking for liver and every other kind of testing because that can be all affected with alpha.
You bet.
So.
You bet. So somehow did you figure out the diagnosis, or did they figure out the diagnosis, or then you said, hey, this is a whole thing, then it's a systemic disease, it's not just a lung disease?
Yes, so they found the diagnosis. He actually said that my tests and everything looked like I had about the lungs of an 85-year-old who smoked for 55 years instead of a 42-year-old that smoked for 25 years.
That's not the kind of aging you want to have, right?
No, not at all.
All right. Now, how did you feel when you were received that diagnosis, and what was the initial treatment plan?
You know, it was just shock at first. I don't think I really understood most of any of it. The original treatment plan was oxygen arrived that night. So
wow.
I was immediately put on oxygen, and then several different meds to try and get me up and back to where I was. So.
All right. Now you're getting weekly infusions of this medication. Essentially, it's a replacement of the enzyme you're missing. We're going to talk a little bit more about that in just a moment. You told us that you compare it to adding oil to a car.
Yeah, so for 42 years, I did not have this protein floating around in my body, just like driving a car without putting oil in it. And then I found out that I could put oil in it. So there might be little bits of metal floating around in my lungs, and there might be cracks in the block, but if I add oil to the
Are you leaking oil? That's what we really want to know. Are you leaking oil?
I'm not leaking it. I just never had it. So.
All right. Dr. Riley, can you explain just a little bit what alpha-1 antitrypsin deficiency is and how it relates to emphysema? And then we're going to talk a little bit about this replacement of alpha-1 antitrypsin.
Yeah, alpha-1, the main purpose of it is an anti-inflammatory. It binds to different inflammatory proteins in the body, neutralizes them, and quickly eliminates the inflammation. It's a protein that's made in the liver, and that's its factory. And then it is secreted out into the body, predominantly in the lungs. So whenever we inhale something that may trigger inflammation, or we have like a small bronchitis or a little pneumonia, or the tobacco smoke or any other inhalational exposure, this alpha-1 goes in there, binds to it, and helps neutralize that inflammation, cooling off the lungs.
All right, so it's kind of a repair substance, but you said it affects both lungs and liver. The liver makes it, but people develop liver failure too if they don't have enough alpha-1. Tell us about that.
Yeah, absolutely. So what ends up happening is in people who have the genetic defect, that alpha-1 protein ends up misfolding, kind of like a corkscrew. And so it's made in the liver, and then it's misfolded and not able to be excreted from the liver. So it builds up just like a traffic jam and toxically accumulates in the liver, causing liver cirrhosis and liver damage. subsequently, you don't have enough of it floating around in your body. And so the inflammation in your lungs runs unopposed and just keeps causing more and more inflammation and breaking down the lung tissue.
So we had a picture of, because I always like to confuse our studio team, they put a picture up of the lung while I was talking about the liver. If let's look at this picture of the lung and talk to us a little bit, what's going on at that level? And those are little air sacs with some blood stuff going around them.
Those are the alveoli, or the air sacs we have. We have millions of them in both of our lungs. The alpha-1 protein circulates in the blood in those alveoli, and if tobacco smoke, vaping, other exposures or occupational fumes that we breathe in goes into those alveoli and those air sacs, it causes damage and inflammation, and that alpha-1 protein helps clean it out. But if we're deficient in it and it's stuck in the liver, then that just inflammation keeps running cyclically and just causing more damage, destroying all those alveoli. It impairs our ability, it makes it hard for us to breathe and get oxygen.
And just to be clear, because I'm going to bring it up, you said vaping, so vaping can accelerate the damage from alpha-1 as well, so don't be thinking now vaping's safe out there, is that right?
I agreed.
Okay, thank you. Just want to make sure we have a little bond about that. Now, okay, how common is this condition, and how do you typically diagnose it?
Yeah, I think that's an interesting point. A lot of people would describe alpha-1 as a very rare disease. However, it's rarely tested and it's actually under-recognized. When we think about it in two statistics, in the general population, we know that it occurs about 1 in 2,000 to 5,000 people. That's on the order of CF, or cystic fibrosis.
That's 1 in 3, so 1 in 3,000.
And people being carriers is about 1 in 50 to 100 patients. So this could be anyone that we see today going through the grocery store, just kind of walking through the hospital. It's very likely we're going to see multiple people who are carriers.
Isn't that interesting? You can be a carrier and not even know it, because most people do okay as a carrier. It's if you have both genes wiped out for you that things are bad. So now, I think we have some scans of Becci's lungs. Is that right? Talk to us a little bit about what we're seeing and maybe kind of what we're not seeing in those scans.
Exactly right. So you see a lot of white lines kind of going throughout both of those lung tissues. Those are all the blood vessels. So what we like to focus on is that black and dark gray areas in between it. And what you'll see is generally both of those lungs are just very, very dark, and that indicates a loss of lung tissue or emphysema. And then the other subtle thing to see is on the image on the right, the lungs at the bottom, we're kind of forward facing on her, the lungs at the bottom are blacker than the lungs at the top. And that's a little bit more common you see in alpha-1, where you see a lower lobe emphysema than you do at the top.
Emphysema is everywhere, but man, it has a big predominance down there at the bottom part. Now, Becci is getting the alpha-1 antitrypsin infusions every week. I understand we can't undo the lung damage. We'd love to be able to do that. We haven't figured that one out yet, but it can hopefully prevent more damage. Is that right?
Yeah, so the alpha-1 protein replacement, or sometimes we call it augmentation, boosts the levels, puts oil back in the tank, and gets it back to more of a protective level to help fight off the inflammation. It makes people feel better, it helps preserve some of their lung function, and overall helps with their quality of life.
Now, Becci, how often do you use supplemental oxygen? Because you're not on it right here as we sit talking.
I'm not. I use it when I exert energy and then whenever I sleep at night.
All right, so that's quite a bit of part of the day then.
Yeah.
So if you go to the grocery store, if you have to go run around, if you want to go out to dinner, you're going to have to wear some oxygen with you.
Yes, or go at a very slow pace.
Yep.
Yes.
Becci, you're still able to stay active, though, I hear.
I am. I am.
So you shared photos of yourself kayaking.
Yes.
You're not wearing oxygen in these pictures.
No.
Does your doctor know about that?
I do wear it to get my boat in and to get my boat out. I don't wear it while I'm on the water, partially because I don't want it to fall in the water, and partially because I don't feel short of breath whenever I'm doing upper body.
Yeah.
So it's whenever I'm doing the lower body and the upper body that I really feel it.
Did you watch kayaking during the Olympics?
I did. That was insane, wasn't it?
Right? That was pretty cool. Both the canoeing and the kayak, I watched those because I like to be in the water. So now, where do you like to kayak?
Lake Olathe.
Okay.
Yep.
Beautiful places to get out to. Now,
Yeah.
I understand you're pretty crafty. You shared a photo of Christmas trees you made out of high-flow oxygen tubing. Okay, I've got to tell you, I've been in pulmonary disease for 34 years. That's the first I've seen that, a tubing.
There is a ton of waste with this disease.
Yes, there is.
There's just so much that you can't recycle. So I upcycled some things for my first year of Christmas. So
how did you paint the tubing?
it was green. it's green tubing.
Okay, all right, so that's pretty darn good. Oh, Christmas tree, oh, Christmas tree.
Just keep me breathing.
How beautiful is thy tubing. All right, now you're also a mom,
Yes.
and since you've had this alpha-1 antitrypsin disease, and it's a genetic condition, are your kids tested?
My kids have been tested.
And good news, I hope.
Well, it's good news is that we know how to move forward. We know that we need to be cautious of certain things and be more cautious of other things. Don't go sucking on tailpipes, right? So.
Yeah, that's well said. Yeah, that's right. Don't suck on tailpipe. Don't freaking smoke, and don't toke, and don't. Oh, that's I'm an older guy, so we say smoke, toke, or vape, or any of those other things. Even the young pulmonary guy, he just laughed at me when I said toke. What's that about? Dr. Roy, what does this mean for Becci's children?
Well, it's very fortunate they have such a good advocate in their life, but kind of echoing what she said, living a normal, healthy lifestyle, avoiding anything that may cause inflammation in the lungs or damage to the liver. So minimizing any tobacco or alcohol use will help them live a normal life.
Your liver's okay?
My liver's great. Yeah, I've gone through the
Awesome.
testing and my liver's doing all right. Slightly fatty.
Why do some patients have the liver problem and some people have the lung problem from alpha-1? I've never understood that.
Yeah, it's still a little unclear, but if the people have both bad genes, the Z, they're more likely to develop the liver disease as compared to someone with the other abnormal gene, the S or the F or the I variants.
So it depends on which kind of gene you have.
Exactly.
And then you combine that with smoking, so you give yourself both the damaging thing to your lung, and you don't have the ability to clean it up so much, and that really causes that.
Yeah.
And is that the reason that the lungs have more disease in the bottom part in this, because the tobacco tends to accumulate down there more or move down there
And
more?
blood perfusion at the bottom of the lungs has there should be more of the alpha-1 circulating down
And
there.
there's less in this edge. Because
Exactly.
Yeah, that's a problem. Now, Dr. Riley, patients don't just rely on medications. Talk to us a little bit about pulmonary rehab.
Yeah, and I really like the idea of pulmonary rehab. So many times you go see a doctor and it's, here's your breathing test, this is how you're doing now, here's an inhaler, I'll see you back in 3 to 6 months. But there's more to medicine than just the inhaler and the return to clinic appointments. But pulmonary rehab has a lot of great attributes, and kind of in twofold. One, it really helps improve their symptom management. They're able to walk farther, they're able to breathe better. It's a program that they spend about 1 to 3 days a week for 30 to 60 minutes, focusing on different breathing techniques, education, and exercise that mirror their lifestyle. So walking or bicycling on a recline bike against resistance. One of the unsung praises about it is the mental strength and fortitude that comes from pulmonary rehab. You get to meet other people who are struggling with diseases similar to you. And you get a lot of face time with physical therapists or exercise therapists, respiratory therapists, who are able to coach, listen, and talk to you. So a lot of great things and long-lasting benefits from pulmonary rehab.
You know, I can't agree more. To sing those praises of pulmonary rehab is such a big part of it. I think anybody with chronic lung disease who is not already in an exercise program on their own needs to go through pulmonary rehab. You can double and triple what you can do through pulmonary rehab. So do we have to do pulmonary rehab, or had you
I
already
just
done?
completed.
What'd you think?
I really enjoyed it.
Yeah.
The safety of the cardio ward was nice, so if there is anything that went wrong, but it taught me that I could push my body a little further than I'd used to, and you know, that I have to work my body or my body won't work.
I love your turns of phrase. You're pretty good. You should be right. So, and how often do you get out to go kayaking?
I get out about once or twice a month.
Yeah.
I actually don't prefer to do it in the heat of summer. I'd rather do it in the icy winter.
Okay.
So
Don't fall in, but yeah, I'm with you.
That's never the goal.
Yeah.
But yeah, I get out as much as I can.
So, Dr. Riley, if emphysema and COPD gets severe enough, we can implant special endobronchial valves to help the lungs. Talk to us a little bit. First of all, what the heck is that, and who's the right candidate?
Yeah, absolutely. So because of those millions of air sacs that die from the emphysema, parts of the lung become more diseased or ballooned out. And those lungs, those sections of the lungs don't help with oxygen or blood moving around. And so what was found about 7 to 10 years ago is if you go in down through their windpipe and you place a valve or a small plug in those diseased lobes, that lobe collapses down and more blood and oxygen go to the healthier portions of the lungs, makes people feel better, it improves their breathing test numbers, and changes kind of the overall lung structure to go back to a normal size, making it easier to breathe.
The diaphragm starts to work better like that.
Exactly.
It's a huge difference. So, we used to do lung volume reduction. Is that even with a surgical approach to trying to do that? Didn't we do that anymore, or has this just replaced it?
This has essentially replaced it. We have interventional pulmonologists here at the University of Kansas who do this procedure, and it is minimally invasive. They don't have to undergo surgery. That may preclude even further transplant. So it's a much better option.
All right, this has been an awesome discussion. We are here to answer your questions. Send them using the links on your screen with YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk. Dr. Dana Hawkinson, our Medical Director of Infection Prevention and Control. COVID is starting to pick up again.
Yeah.
That wastewater testing has gone up, and then hospitalizations are going up nationwide. Talk to us a little bit about what's out there.
Yeah, unfortunately, and it's good to be back here in studio.
Yeah, we like having you back in the studio, because how can I make fun of you in a late? That was hard to do.
It was hard, but it was a good. We served a good need down there. We're helping all those patients, so it's really beneficial for everybody, and it is actually good to be down there. So yeah, what we've seen the last few weeks, unfortunately, was that increase in wastewater testing, increase in emergency room visits, increase in test positivity for COVID-19. We know that virus was circulating. We had hoped that we would see a peak earlier than this because we know school is starting. And so when you have school starting, you have that much virus circulating. People are infected. We know loved ones, friends have been infected recently. They can easily bring that to school or the workplace. And then when you have so much contact with other people, those people can also bring it home to people who may be more at risk of severe disease and hospitalization. But what we have seen from the latest data posted yesterday was that there has been a slight decrease in that wastewater detection from August 10th data. And if you see there far on the right, you'll see those lines. The top line is the West, but if you look down toward the middle of that graph, the black line is the national rate or average detection of SARS-CoV-2 in the wastewater. And then below that is the yellow. That is the Midwest region right there. So we have seen a slight decrease in that peak of detection in wastewater. Hopefully that means that the virus is decreasing in circulation. The most recent data from the CDC shows that there is a very, very slight decrease in the amount of people going to the emergency department for COVID-19. You'll see this. So 2.4% is what they showed as far as percentage of weekly visits of people going to the emergency department for that. Overall, just a slight 1.5% decrease from the previous week. Overall, though, if you see on that far right, that right box there, no absolute decrease, but hopefully this is just the beginning where we can start to see overall decreasing amounts of virus circulation, decreasing amounts of people going to the emergency department looking for care for this, because we know now we are going to be entering into respiratory viral season, and I think at some point in the next few months we would probably have to expect an uptick not only of SARS-CoV-2 but also unfortunately influenza and RSV as well.
And just to say it out loud, we went from like 7 to 24 patients. Today we're at 17, so that's a little bit of an improvement. We all know that can bounce around a little bit. Hopefully it won't do too bad. I don't think anybody saying everybody go run out and wear a mask, but I think I would say to some people with underlying lung disease is pretty severe. You better be extra careful. Make sure if any family member or people around you are sick, they need to wear a mask because you don't want to get sick from them. There's a lot of COVID out there.
Yeah, and I think we should always continue to recommend and endorse those pillars of infection prevention, as you have always said. I think going forward, especially right now, hand hygiene is going to be the most important thing to do, especially as we're talking about schools and schools getting back. So it's vitally important to continue to use adequate, frequent hand hygiene with soap and water, or hopefully there is still maybe those alcohol-based hand sanitizers available for ready use in those schools. Using those hand sanitizers and washing your hands frequently, and also avoiding putting your hands in your eyes, your nose, or mouth, are going to significantly cut down on your chances of getting any of these viruses, which may be on those high-touch surfaces and in those environments where you're at.
All right, we know many of you have a lot of questions. Let's head to Studio B with Alexis. Good morning, Alexis Del Cid.
Good morning, and Vera has an excellent question. Vera writes, just curious, but can alpha-1 be caused from COVID, or could a person have alpha-1 and COVID made it worse, being unaware of possibly having alpha-1?
Well, I don't think COVID causes alpha-1, but it can make it a lot worse.
Absolutely, and if the virus going in there, you're more predisposed to getting a severe form of that viral illness, may need more oxygen, you may need to go to the hospital or need higher escalating antiviral medications, and it would take longer to recover from it because they don't have the ability to help clean out and control that inflammatory response.
It'd be so hard. Have you had COVID?
I have not.
Oh, keep up the good work. And you're
Knock on wood.
I hope, yes.
Yes, I am.
Awesome.
Multiple times.
Man, that's one of those questions you're not supposed to ask because you don't really know the answer of it, but I thought you would be.
I think I've had 6
You're
doses.
that person.
Yeah.
You probably haven't asked me as Hawkeye. I think he said 16. I don't know.
I love it, man. I love the vaccines.
It's so good when it
Give
hits
it
your
to
blood.
me. I know, right? Just feel it.
Okay, let's move on. Next question.
Well, Jill has a follow-up. To piggyback on the question that we just had from Vera, Jill wants to know from Becci, when you get a cold or the flu, does it make it worse because you have alpha-1?
You know, luckily I haven't had the cold or the flu, but I did have my very first exacerbation where I believe it was caused from sweeping off my patio. So just having a little bit of dust into my lungs really knocked me out. I was on extra oxygen for 2 weeks and 2 rounds of antibiotics and tons of, prednisone, right? So I've learned.
Stay healthy is the answer to this.
I've learned as soon as I feel ill, I just sleep. I just stop what I'm doing and go lay down. So.
Yeah.
But did you say it was caused by sleeping on your patio? So you were just trying to get fresh air?
Sweeping dust off my patio.
Sweeping. Okay, I thought you
Yes.
said you were. Can you go outside during allergy season, or does that make it worse? You just stay in with the air on? Like, can you keep the windows open?
Allergies haven't really affected me, but there's tons of pollutants in the air that I kind of constantly am aware of. For instance, if I go into a store or park in a parking lot and see somebody smoking outside, I tend to wait until they're done smoking before I go into the building.
Jeremy wants to know, how can you tell the difference between this versus chronic asthma or frequent bronchitis?
Actually, there are many alphas that have undiagnosed or misdiagnosed asthma, as well as multiple rounds of bronchitis. So if you've got those kind of symptoms, it might be worth a test.
Exactly right. And some of the studies of the alpha-1 net showed that people are misdiagnosed as asthma. It's a great mimicker, and they'll wait 5 to 7 years, see 2 or 3 different doctors before reaching that final diagnosis of alpha-1.
Janet Coy has a question for Dr. Hawkinson. Janet wants to know, Dr. Hawkinson, when should high-risk adults get the RSV vaccine?
Yeah, so RSV vaccine came out for adults. There was also a maternal RSV vaccine available as well. But RSV vaccine for adults, there were 2 that had come out last year. We're actually going to have a 3rd company now. Moderna, I believe, has been FDA approved for their RSV vaccine as well. So currently the recommendation is that adults 60 and over should receive a dose of RSV vaccine. If you have not received a dose last year when it was first available, then get your dose this year. So again, most all adults, especially those that are high risk, you really need to speak with your doctor about that. But they do leave it open to discussions with your medical provider. But I would really say that really, if you are 60 and above, it's probably going to be a benefit to get that RSV vaccine, and that would be the recommendation. That's what it's approved for. And again, right now there will be and are 3 adult vaccines available. It's just a matter of where you can find them at the local pharmacies or your physician's office.
I have a question for Becci. Not related to your medical condition, but do you sell your artwork on Etsy? Because those Christmas trees were so cute. And also, did you knit those hats in the family picture?
I did. I did knit the hats. If you can imagine, I was in a chair for most of that first year, so I just stayed pretty sediment. Etsy, no, but gosh, with all the oxygen tubing I've got, I would have endless supplies. So.
And those little things are so cute.
Well, thank you.
We have a question from Stu. Stu wants to know, Becci, have you ever had trouble getting on a plane with supplemental oxygen?
So I've flown a few times since I've been diagnosed and had oxygen to fly with. And I just recently learned that you have to have enough battery power to last time and a half of your flight path. So if you've got 5 hours of flight, then you need to have 7.5 hours of battery life. So a lot of the, how do you say, the stuff that you rent on a daily doesn't have that backup battery stuff, so you have to rent travel oxygen or
Oh gosh.
provide your own backup batteries. Yep. They almost didn't let me fly out of Florida.
Oh, that would have been a problem. That would have been a
I
problem.
was like, no, please, let me go home.
Hey, you brought something you want to show us. So
Sure.
we should just talk about this. for a
So
moment.
the testing is actually free, and it comes in a self-stamped box, and you just swipe your cheek, and it'll test for many different versions of the alleles, and
All right.
get you a good heads up. It is not shared with anyone until you share it with your doctor. So
can
it's a
you
good
get that
anonymous.
yourself? If you think you have it, can you get that yourself? Somebody will send that to you?
So if you do have multiple bronchitis rounds or asthma that just doesn't seem to go away, or if you feel like you just want to, it's a free test. You can order it from Grifols.
So I bet you if Alpha One antitrypsin diagnostic test for free online, I bet somebody will
Yep.
take you to that website. You don't even need a doctor's order for that, is that right?
Nope, you don't.
That's awesome.
You can test anyone and everyone. You just have to have an email to get the results back. So the other great place for information on this is Alpha One's foundation website.
Yes, there is a big foundation that helps raise awareness, can help support scientific study. Talk to us a little bit about that.
Sure,
that
Alpha One Foundation is amazing. I know everything I know about this disease from them. I learned to look for Dr. Riley with this foundation. So I recently became a support group leader for them. There was not one in the Kansas City area, so I got on the map and said, sure, I'll volunteer. So
That is awesome.
Yeah.
That's awesome. So this has been a great discussion. I am just so grateful to our guests for being here. I want to hear some final thoughts before we go. Becci, you've got to come back because you're like a natural here. And you got a pretty quick wit. That fits right into this program because at least one of us has a quick wit. It's Hawkeye, it's not me. So, okay, final thoughts that you would have today.
final thoughts. You know, I look at this as the hand I was dealt. So as much as I can do positive with, I've got this hand, yeah, it's a crapshoot, but if I can share and get the word out and share everything I can about it, the earlier you know, the more testing that can be done and the more information we can gain to find a cure. So.
All right, that's awesome. Dr. Riley.
Absolutely. The Alpha 1, it's definitely under-recognized. Only about 5 to 10% of people with COPD ever get tested for it. So there's a genetic reason out there, free testing. It's easy to get access to, and just get out there and start testing people.
Yeah, that's a Hawk.
Yeah, great questions. You know, again, we are hopefully seeing decrease in the amounts of SARS-CoV-2 out there, but we know it still is out there, so please take precautions. We've talked about frequent hand hygiene. That is going to be vitally important. Unfortunately, we are getting now into respiratory viral season, so hopefully that new updated COVID vaccine will be out in the next couple of weeks. It is recommended for everybody 6 months and over to get that. If you've had COVID recently, we certainly recommend and endorse. You can probably wait about 3 months before getting that COVID vaccine, that updated vaccine. It is vitally important. It will help reduce your chances of severe disease and hospitalization, but also can help reduce your risks of things like long COVID, which we know affects millions of people in our country on a daily basis as well. The new influenza vaccine should be out in a couple weeks as well, but right now influenza activity in the United States is extremely low. And then of course we had a question about RSV vaccine. It is certainly recommended for adults, especially those high-risk adults over 60. I would just say if you are over 60, it's probably a good idea to get that RSV vaccine. If you got one last year, you should be covered. Right now the recommendation is only to receive one, but please talk with your medical provider about that.
All right, thank you, sir. Well, here's a story. So years ago, when I was back in the 90s, I was a younger pulmonologist then. I had hair. A younger woman came to see me who had been diagnosed with Alpha 1, and we put her on Alpha 1 antitrypsin replacement. She lived for many years after that, first with replacement for about 10 or 12 years before she had a lung transplant. And then she lived for about 20 years after that lung transplant. She died. We put all those numbers together. She died in her 70s, having raised her children and grandchildren, and having been one outstanding chef. There is always hope. The worst thing you can do is not ask the question, do I have it? So thanks for bringing this information. You can get that done for free. Make sure you don't let your questions go unasked. Thanks again to all of our patients and to all of our guests, or both, and to our audience. Remember, faith, hope, and science, together we can. We'll see you next week.
Coming up Friday on the Morning Medical Update, 5-year-old Jada's sore throat wasn't getting better. Her parents had no clue her airway was in danger of closing completely. I'm Jessica Lovell on the next Morning Medical Update. The dangers of untreated strep throat. Jada's road to recovery after an unexpected surgery. Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.